Greetings to everyone on this platform. I'm by the names of Naturia Florence, midwife at Medsafe Hospital. So today we are going, as usual, we always go through our talks, always on Friday. So today we are going to look at the importance and the benefits of antenatal care to all mothers, those who are expecting, and even the post-delivery mothers, because anytime you can resume, or it can be a good information to a friend. So I welcome you on this platform as we are going through today's topic. So first and foremost, we are going to look at what antenatal care means. So at the end of that day, or at the end of this session, I expect every mother or whoever has been on this platform to be in the know of what antenatal care is, when to start antenatal, the importance and the benefits of doing antenatal care or services offered during antenatal visits. Because we have seen that most mothers, they take it for granted. They are like they can decide at any time of their wish to start antenatal, which is wrong, because there are very many things you miss out. There are very many things you miss out. So we say that when you start your antenatal early, more especially if you start it before the 3 months have elapsed, there are many things which are captured. Or in case of any condition that may harm your pregnancy, you find that it's identified early and it's treated or managed. So going straight to the point, we are going to look at what antenatal is. So antenatal care by definition is that care you receive while you are pregnant to make sure that you, the pregnant mother, and your baby in the womb or whom you are carrying in your uterus are as well as possible. So always people ask, when should a person or a pregnant mother start antenatal? Ideally, first antenatal or first visit should be started as soon as you detect you are pregnant, or as soon as you miss your last menstrual period, or when you have got a positive pregnancy diagnostic test. And this is done when, for example, when you have missed your last menstruation period and you are suspecting pregnant. Immediately you just go to the hospital, whether you have done a test or not, but so long as it comes into your mind that you might be pregnant. If you are doubting, a test can be conducted at the hospital and the confirmatory results are given to you. So there, I think I'm clear. Always people ask me, so I want to start my antenatal when I'm 8 months. Some people, they reserve the pockets. Others, they just do according to their wish. But it's wrong. Because in case of anything, you'll miss it out to be detected and you are hoped. And you are hoped on time. So antenatal within the first 3 months of pregnancy is especially very important in the treatment, like I said, in the treatment of the health issues that may lead to the complications for mothers and the baby later on. So first trimester is that period we are talking about, which is from the time you are expecting you have conceived up to before 14 weeks of your gestation. That's what we call the first trimester of gestation. So we are going to look at the importance and the benefits of antenatal care or visits or antenatal checkups. So before we go there, we always have the 3 components of antenatal care, which guide us through our antenatal. So during antenatal, we do the assessment, we do the health promotion, and then we do the assessment and the health promotion. So there, where there is assessment, this is when we do the history taking, we do the physical examination and the laboratory tests, as we shall see further. And then under the health promotion, this includes advice on the nutrition, planning, the birth, then information regarding pregnancy, subsequent contraceptions, and then breastfeeding. Hope we are moving together. So when we go to the importance and the benefits of antenatal, number 1, during antenatal visits, pregnant mothers or pregnant women are checked and treated for any condition which may harm her pregnancy, and such conditions are as malaria, anemia, HIV/AIDS, and STDs. So here you find that when you start your antenatal early, there are some people who suffer malaria and they don't feel the signs and symptoms of malaria. So by the time they realize, it has already affected their babies. Then they end up having babies dying in their womb, or leading to premature deliveries, and then also causing them having anemia. But if you come early, we do the tests, and if we find any, you find that it's treated, anemia is corrected, and you continue living a healthy life plus your baby. So when also HIV, for example, you can be there when you don't know your cell status. So when it's detected, and the STDs, because these are conditions which can cross to your baby. So when they are detected early, for example, the HIV, we do the needful to say that you are started on the treatment, so that we stop this HIV from crossing to the baby, and you also to remain when you are healthy and strong, so that you can carry your healthy pregnancy, and at the end you can still stand strong to live and to continue with your you continue with your daily duties as you are taking care of yourself plus the children you have. So another importance and benefit, the pregnant woman, so when you come for the checkup or for the antenatal visit, you will find that your urine is tested. Blood is tested. So blood, there are very many things we test from it. We always test the volume of blood you have. So this volume of blood will tell us, or it will help us to rule out anemia, whether the blood you have is enough or it's reduced, so that we do the needful to say that we boost it. So the urine also helps us to find out some conditions, like, because there are some people who sustain some conditions because of the pregnancy, they are pregnancy induced. For example, diabetes, gestational diabetes. So when we take off the urine, we shall find out whether there is sugars in your urine, or you are still living a healthy life. It also helps us to rule out the proteins, which will help us to know whether your kidneys are still in a good working condition. And then in the blood, you also check for the HIV, because it's checked using a blood sample. Then we know the blood group. There are some people who have blood groups with without any rhesus factor. So when it's identified, we prepare you to buy the anti-D, because at times we don't know, you may not be having the rhesus factor, but when your husband is having it, so later on it may affect your subsequent pregnancies. So when you don't come for the checkup or for the antenatal visit, we shall not be able to rule out these things. Then you find that we always, wherever you come for the checkup, we always do blood pressure check, which will help us to rule out the the pregnancy-induced blood pressure. Because now if this pressure is not checked or is not detected early, it will endanger your life as the mother who is carrying the baby, and at the same time it will affect the fetus also you are carrying. Then we examine we do abdominal examination, whereby we see how the baby is growing, whether the baby is growing or not. We check for the position of the baby. Your weight is also taken. Yeah, all these parameters are used to see how you are standing and how the baby is also growing in the womb. So another importance of antenatal visit is that when you come, we encourage family interactions and bonding between the husband, wife, and their baby to prevent unwanted pregnancy and other post-delivery complications. So here we see that good antenatal care prepares the family for the coming baby and the post-delivery life. Because some people, they are carrying their first pregnancies and they don't know what is next. So the more you come and the more you attend to the scheduled visits, we keep on talking to you, letting you to know through all different processes, the process of pregnancy, the life after pregnancy, how you take care of the child or the baby, how are you going to space after delivering your baby. So all these, they become easy when you do your antenatal, because they're in the package. Then another importance of having antenatal care, you find that it provides opportunity for the women to ask any question she may have about her pregnancy and her baby's development. Because always it's an open platform. You find that you are free to your midwife or the doctor who is taking care of you on that scheduled visit. Because you find that some people or some mothers, they are misled by the colleagues outside there. So when you come to the hospital, you interact and they correct some of the myths they always tell you outside. Because we have seen mothers who are deceived by their colleagues and they are denied of eating some foods, and in the other side, they would be good for the child's development and even for the good of their babies. Then others are given some herbals which end up affecting their pregnancies. So when you come to the hospital, you are helped, and some of the things are corrected. So timely initiation of the antenatal care can avoid pregnancy-related problems, like we said earlier, and it saves the lives of the mothers and their babies. For example, if you come and we detect like you have pregnancy-induced pressure, because when this pressure is not attended to, it keeps on growing and it advances into other conditions, which may end up taking your life and the life of the baby. So when it's detected early, due to the subsequent visits, it's treated or managed, and you find that you remain safe. Another importance, it promotes and maintains the physical, mental, social, and health of the mother and the baby by providing the health education on the nutrition, personal hygiene, birthing process. Because you find that just like as I'm talking, this is already a healthy talk to let you know the importance of doing antenatal. So as you keep on coming, we keep on telling you what will help you along the way. Because here you find that when some people get pregnant, you find that their mental status change. You find that they change, others they become very stressed, they find that they cannot do anything, others they feel it is a burden. So as you keep on coming for your antenatal, you find that you are talked to and you are shaped, you are helped to cope up with the stresses of the pregnancy. And then we prepare you also for the next phase during the labor process, and then you are also prepared for the time after birth. So you are hoped also to get knowledge on the nutrition, because we have seen mothers who are misled, and then you are like, no, don't eat this, you'll make your baby very big. No, we are not determinant of the sizes of our babies. So you find that the mother keeps on losing just because he has been deceived by a friend. So we correct some of the things and you remain on point so that your life pushes till you deliver your baby. Then another thing, subsequent antenatals, they help us to detect and manage complications during pregnancy, whether medical, surgical or obstetrical. So waliwo ebizibu ebirala ebisobola okubeerawo during pregnancy and you don't know. So when you come, they are detected early and they are worked upon. Then subsequent antenatal care, they help develop the birth preparedness plan. Last time we talked about birth preparedness plan, but one time we shall repeat it. Birth preparedness plan and getting ready to its complications. So we see that some people, once they get pregnant, they are like, me, whichever will be there. Then they find difficulties in handling when situations deviate from normal. But when you come for antenatal, we help you to make a birth plan so that you get ready of anything which can come across and you are able to handle. Then it also helps us to ensure the medication women take are safe. Because we see that when you are pregnant, you are not like any other person who is not pregnant. There are some medications which are not safe when you are carrying your baby. Others, they are not safe depending on the gestation period you are in. So when you come to the hospital, it's very easy for the health worker or the midwife or the doctor to help you decide in case of which condition and which drugs are safe for you to take. So we give you useful information. Another thing, it helps you to get useful information to help you have a healthy pregnancy, including advice about a healthy advice about a healthy eating and exercise, like we said on the nutrition. Hope we are together and we have picked something in this session. So in conclusion, I may say antenatal care is a key strategy to improve maternal and infant health. So if we attend to antenatal, it will help us to minimize most of the hazards which may harm our pregnancy when they are detected early. So I call upon all mothers, fathers, those who are expecting, always to take antenatal care as a key strategy to see that we remain healthy, and it will help us to keep our pregnancies healthy so that we achieve at the end of the 9 months, we end up with our healthy babies, and we also remain in good health. Thank you very much. In case of any question, you can pass it on our platform where you are listening to this session. Then answers can be forwarded according to your questions. Thank you very much for listening.